The management of diabetes has come a long way since the discovery of insulin in the early 20th century. For many diabetics, insulin therapy is a life-saving treatment that helps them manage their blood sugar levels and prevent complications. Despite its benefits, insulin therapy is not without risks. Some of these dangers are less discussed, but are important for anyone considering or currently on insulin therapy.
But before we continue, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button and hit subscribe. Thank you, and let's begin.
Insulin therapy is a delicate balancing act. The primary goal is to keep blood sugar levels within a target range. Too much insulin can lead to hypoglycemia, a condition where blood sugar levels drop too low. Symptoms of hypoglycemia can range from mild, such as dizziness and sweating, to severe, including confusion, seizures, and even loss of consciousness. A study published in the Journal of the American Medical Association found that severe hypoglycemia is associated with an increased risk of cardiovascular events and mortality in patients with diabetes. This risk underscores the need for careful monitoring and management of insulin dosages. On the flip side, insufficient insulin can result in hyperglycemia, where blood sugar levels are too high. Chronic hyperglycemia can lead to a host of complications, including damage to the eyes, kidneys, nerves, and heart. The constant vigilance required to maintain the delicate balance between hypoglycemia and hyperglycemia can be mentally and emotionally taxing for patients, contributing to a decreased quality of life and, in some cases, diabetes burnout. One often overlooked aspect of insulin therapy is the potential for weight gain. Insulin promotes the storage of glucose in fat cells, and this can lead to an increase in body weight. Weight gain can exacerbate insulin resistance, making it more challenging to manage blood sugar levels and potentially necessitating higher doses of insulin. A study in diabetes, obesity, and metabolism found that insulin-induced weight gain is a common issue, particularly in type 2 diabetics. This can create a vicious cycle where increased insulin resistance leads to higher insulin requirements, further promoting weight gain. There is also the issue of lipodystrophy, a condition where the subcutaneous fat tissue at injection sites becomes either hypertrophic or enlarged, or atrophic or diminished. This can result from repeated insulin injections in the same area. Lipodystrophy can affect the absorption of insulin, leading to erratic blood sugar control. Patients are often advised to rotate injection sites to minimize this risk, but even with proper rotation, some may still experience this complication. Allergic reactions to insulin, though rare, can occur. These reactions can range from local irritation at the injection site to more severe systemic reactions. Modern insulin formulations have reduced the incidence of allergic reactions compared to older animal-derived insulins, but they are still a concern for some patients. Managing an allergy to insulin can be challenging and may require switching to different formulations or additional medications to control allergic responses. Another danger associated with insulin therapy is the potential for insulin overdose. This can happen accidentally, especially in patients who are newly diagnosed or who have recently changed their insulin regimen. The consequences of an insulin overdose can be severe, leading to profound hypoglycemia, seizures, and even death if not promptly treated. This highlights the importance of patient education and support in managing insulin therapy. The financial burden of insulin therapy is another significant concern. Insulin is expensive, and the cost can be prohibitive for many patients, particularly those without adequate insurance coverage. This financial strain can lead to patients rationing their insulin or skipping doses, which can result in poor glycemic control and an increased risk of complications. A study in the Journal of Diabetes Investigation highlighted the impact of high insulin costs on patient adherence and health outcomes, emphasizing the need for more affordable treatment options. One of the most concerning long-term dangers of insulin therapy is its potential impact on cancer risk. Some studies have suggested a link between high insulin levels and an increased risk of certain cancers, including breast, colorectal, and pancreatic cancer. Insulin can promote cell proliferation and inhibit apoptosis, processes that can contribute to cancer development. While the evidence is not conclusive, it raises important questions about the long-term safety of insulin therapy. Researchers continue to investigate this potential risk, but it remains a point of concern for patients and healthcare providers alike. Despite these risks, insulin therapy remains a cornerstone of diabetes management. It is crucial for patients to work closely with their healthcare team to optimize their treatment plan and minimize potential dangers. Regular monitoring of blood sugar levels, proper injection techniques, and attention to diet and exercise are all essential components of successful insulin therapy. Interestingly, the future of diabetes management may offer alternatives to traditional insulin therapy. Advances in technology, such as continuous glucose monitors and insulin pumps, are already improving the lives of many diabetics by providing more precise and automated insulin delivery. Researchers are also exploring novel treatments, such as artificial pancreases and gene therapy, which could one day reduce or eliminate the need for insulin injections altogether. One promising area of research is the development of ultra-rapid-acting insulins, which can better mimic the body's natural insulin response to meals. These insulins have the potential to improve postprandial blood sugar control and reduce the risk of hypoglycemia. Additionally, scientists are investigating the use of smart insulins that can automatically adjust their activity based on blood sugar levels. These innovations could revolutionize diabetes management and provide new hope for those struggling with the challenges of insulin therapy. As we look to the future, it is essential to continue supporting research and development in diabetes care. While insulin therapy has been a lifesaver for millions, it is not without its dangers. By staying informed about the risks and working closely with healthcare providers, patients can better navigate the complexities of diabetes management and improve their quality of life. One of the most intriguing areas of exploration in diabetes care is the potential of personalized medicine. By tailoring treatments to the individual characteristics of each patient, healthcare providers can achieve more effective and safer outcomes. For instance, pharmacogenomics, the study of how genes affect a person's response to drugs, could be particularly beneficial for diabetes management. Understanding the genetic factors that influence how a patient metabolizes insulin or other diabetes medications can help in customizing dosages and reducing adverse effects. Moreover, advancements in digital health technologies, such as AI-driven apps and wearable devices, are enhancing the ability to monitor blood glucose levels in real time, providing both patients and doctors with valuable data to make informed decisions. Another promising development is the research into beta cell regeneration and stem cell therapy, which aims to restore the body's natural ability to produce insulin. These innovative approaches not only aim to improve the efficacy of diabetes treatment, but also significantly reduce the associated risks, such as hypoglycemia and long-term complications. As these technologies and therapies continue to evolve, they offer a glimpse into a future where diabetes management is more precise, personalized, and ultimately more effective. Ultimately, the goal is to find a balance that allows diabetics to live healthy, fulfilling lives while minimizing the risks associated with their treatment. With ongoing advancements in medical science and technology, there is hope that the next generation of diabetes therapies will offer even greater safety and efficacy, reducing the burden of this chronic condition and bringing us closer to a cure.